Well, good morning, everyone. And how are you? Once again, welcome to another live this morning. Hope you're having a great start to your day. I'm just going to hook up my microphones here. Okay, how you guys doing? Did you get your notifications? This one's hard to get on. There it is. Okay. Good morning to you, everyone, and thanks for coming on. Guess what today is? Q&A Friday. Always popular, always fun. Okay, let me just do this one. And let's see if I can say hello to... Yeah, I got to be able to because I see... Okay, let me do this. Yep. Okay, who do I got? April. You're number one on my list. How are you this morning? Suzanne from Edmonton. Janine, how are you? Arlene. Bruno, good to have you on. Grace from Newfoundland. And Wendy from Markham. Brahim, my friend. Sandy, Chilliwack, British Columbia. Dennis from Norwich. Suli, Petawawa. Nick from our staff. Saying good morning to Kevin. Where are you, Kevin? I don't see your name yet. Brandon, Natalie, how are you? Donna from Belt Eward. Maureen, how are you? Today is Maureen's birthday. Well, happy birthday, Maureen. We love you dearly. Rosa and Patricia from Florida. Margaret from Lakelet. Natalie, good morning. Marla, nice to have you on. Arlene, did I say hello to you already, Arlene? Lisa Marie, Georgie, Halifax, Nova Scotia. Teresa from Dunedin, Florida, home of the Blue Jays. Cindy, Joanne, Milika, Patricia, Francis, Maria, Etta, and Maria from Ottawa. You guys, I love you guys. Rosalinda, did I miss you? Lise, and Catherine from Springdale, Newfoundland. Ashley, Anna. How are you, Ashley, Anna? Sherry is on from Mississauga. Karen, Luella, West Tennessee. Hi, say hi to Doc McEwen. I think she's on. I'm not sure. I never see her name or rarely. Carrie from Nebraska. And Mary and Donna. Jim from Sudbury. Jim, where's Sudbury? Never heard of it. Bonnie. And Carrie from Nebraska. There, Kevin, honestly, you are way down the list. How did that happen? Did I miss you the first time? Cheryl and Lise and Marlene. Couple more. April, Marianne, Judy, Port Perry, Serpa. I was waiting for you, Serpa. Sue, Cheryl. Did I miss you, Cheryl? Okay. We love you guys. Hi, Deb. And we're all saying hello. Hi, Diane from Thunder Bay. And Roxanne is listening from the car in traveling to Ottawa from Pembroke. Okay, Roxanne, nice to have you on. Beverly and Amber, Natalie, and Fran. Fran, I must have missed you. Yeah, you're in the clouds, Fran. I don't know why. Okay? Okay, so let's go to our questions today, okay? And Mary's asking about body pH, okay? I read that cancer likes low pH in the body, okay? Now listen. I have done some very good teaching on this subject, okay? So if you would scroll through the Doctors In podcast, look for, I've done at least 3 or 4 of them on pH, okay? So let me go over this, Mary, because a lot of people are confused about pH. Am I interested in pH? You bet your boots I am. but not the way you think. Okay? Not the way you think. Not the way that a lot of gurus think. I'll give you an example. I'll tell you where it comes from. Okay? They look at acidic foods and tell you that that makes you acidic. Like meat is acidic, slightly acidic on the pH scale. Okay? Sugar is very acidic. A tomato is acidic. Coffee is acidic. But that's not significant in this sense. Okay? So when you eat a steak, it's acidic. Does that make it bad for you? No. I'll tell you why. Because your body has a buffering system. Your body releases baking soda, sodium bicarbonate. What does that do? It alkalizes the food. Your body buffers it. That's really important to understand. And it's one of the reasons that a lot of gurus that have the same kind of educational background that I have, they'll tell you that, steak is no good because it's acidic and that's going to make cancer grow. That's the farthest thing from the truth. Okay? That's the farthest thing from the truth. Or get alkaline water and a pH of 9, and that's going to fight cancer. It's so alkaline. Don't buy it, guys. Now, you know my teaching on this. Really important. Your stomach has to be acidic. That is the area of your body that is so important that you have the acidity of a lion's stomach, even more acidic than that. God gave you an acidic, very, very acidic stomach. Okay? Why? So that you can break down protein, that you can break down amino acids, that you can break down all your nutrients. It micro-sizes your nutrients when you have an acidic stomach. The problem in the world is not the acidic pH in the rest of your body. The problem in the world is the lack of acidity in the stomach. That is a huge issue. I talk about it all the time. Because in your blood, guys, your pH in your blood, it's slightly alkaline. You can't make it acidic by eating. When you get acidosis, you're dying. Okay? Like, for example, diabetic acidosis. Now in the blood, the pH of the blood is becoming acidic. And that means your organs are breaking down. That means your body is on its way out. If you know what I mean by that. Okay? So, and this is where doctors, okay, they don't know the difference between acidosis, ketoacidosis, and ketosis. They're two different things altogether. Ketosis is your body burning fat as fuel. It's very good for you. Ketoacidosis is when your body is at its last stage. Your body is now turning on itself and eating away at your muscles even. That's in the blood, guys. Okay? That's pH in the blood. You can't control it. Your body controls that. Your pH it's so tightly controlled. Because your body knows you need to be slightly alkaline. So if you drink water, that water is good for you. But the only place you want to be acidic is in your stomach. And that's the pH I want you to worry about. Because if your stomach pH is so acidic that it'll burn, if you took some of your acid in the stomach, it'll burn a hole in your kitchen table. Why is that so good for you? Well, think of it. As things come into your stomach, forget food for a minute. What about bacteria? What about parasites? What about viruses? They get killed. If your acidity is great, like C. difficile, for example, and H. pylori, for example, fungus, for an example, one of your defense mechanisms is the acidity in your stomach. You know what happens today? People eat so much carbs, crappy carbs and sugars, their pH goes up. You don't want it to go up. You don't want to have an alkaline stomach. It's never fully alkaline. But you don't want your pH to be at 4 in your stomach or 5. You want it to be around 1. It's part of your immune system. It's so important part of your digestive tract. And a lot of people have trouble in their bowel. A lot of people have fungus in their bowel and bloating and SIBO or SIFO, small intestine fungal overgrowth, because they don't have enough acidity in their stomach. It's the pH that you should worry about there. Okay? Not the one in your blood. Now, give you an example. Diabetic acidosis. Okay? Ketoacidosis in a diabetic. Because their sugars are so bad and out of control. Type 1 diabetics have trouble with this. It can kill them. But it just shows you the toxicity of sugar. And that, my friend, when your insulin's not working anymore and your blood sugar is out of control, you can go into ketoacidosis. Sugar is so destructive to your blood vessels and your kidneys and your eyes and your heart and everything that circulation affects, including, but your body buffers it in the blood until it can't. And that, again, like I said, is ketoacidosis, different puppy altogether. Okay? So for more teaching on that, I bring you to the our podcast, okay? Maybe if someone could do that, they could actually post it on our private Facebook group. What numbers of the podcast? Okay, I think are we at 2,000 podcasts yet? I don't know what numbers we're at yet. Okay. I know we're in the high 1,700 podcasts. I don't know. I got to go look again. I forget. Okay. Okay. That was Mary. And I thank you, Mary, for asking the questions. Very, very good question. And there's a lot of confusion out there. There's a lot of voices out there. I understand that, guys. I understand that. And sometimes I feel like I'm the Lone Ranger because I'm the guy that defends steak. I'm the guy that defends eggs. I'm the guy that defends dairy, cheese. I'm the guy that defends coffee. I have to do it every week. Someone puts up, coffee's bad. Coffee is acidic. Yeah, sure it is. But that don't make you acidic. Do you understand what I'm saying? Your body buffers. Your body buffers. Anywho, did you know you made baking soda inside your body? You do. Okay, Barb, what do I think of fermented soy? Fermented it's actually better than ordinary soy because it's anything that gets fermented like that. It's like sourdough bread, right? It's fermented. That gives it more nutrients. That makes it better in terms of insulin and am I a big guy on eating like they do in Japan or whatever, naka? What do they call that stuff anyway? I know that you can make nattokinase from fermented soy, right? And you can even get some vitamin K2 from that. And so I'm not against fermented soy. I don't like soy on its own because what does it do? It elevates your estrogen. It's a xenoestrogen soy. So I'd be careful with it. I'm not saying you can never have a little bit of it. I don't do that, okay? But ladies, if you have trouble with hormones, I'd be careful with it. Now, you can get a soy isoflavone, which is an extract that helps to balance your hormones. That's a different puppy. It's made from soy, but it's an extract. Okay? And actually, that can be good for you. And, okay. Somebody asked another question. Let me just see here. Well, let me do this one because it's along the same lines. Shelley's asking what Dr. Martin thinks of saffron. Now, saffron is a spice. Okay, it's good for you. I like saffron. Okay, it has some benefits for menopausal, perimenopausal women. Would I take it on its own? No, I never found for me. Okay, like I'm a formula guy. Okay, you have to understand where I'm coming from. I was in practice for years. So if a woman came in and they were completely out of balance hormonally, their estrogen was through the roof, they didn't have enough progesterone, their thyroid was slowed to a crawl because of estrogen dominance. And remember, I always talk about estrogen, progesterone have to be equal. Okay, that's really, really, really key. Okay, so, okay, I'll do this because I have the chart in front of me. Okay, forget the writing because you'll see it upside down. See that? See the pyramid, guys? Ladies, see the pyramid? What do we see here? Ovaries at the bottom of the pyramid. You're complicated, ladies. You have ovaries. Men don't have ovaries. That makes us less complicated. It makes you more beautiful. There's no doubt about it. Estrogen makes you more beautiful, but it better be balanced with progesterone. And then when we go up the ladder here on the pyramid chart, you're going to see your adrenals, because that's really important that you don't have too much secretion of cortisol from your adrenals, ad on top of kidneys. Why? Because that robs your progesterone. Therefore, estrogen goes up. You might think, well, my doctor said my estrogen is low. Well, it doesn't matter. It depends on what your progesterone is doing. If your progesterone is lower than your estrogen, you're estrogen dominant. And that'll slow your thyroid to a crawl. So this cortisol and progesterone estrogen, when estrogen is dominant over progesterone, your thyroid pays the price. It slows down. Okay? It slows down. So we're going to do some more teaching on this pyramid. You like my drawing? I flunked art. Okay? I flunked art. So saffron, getting back to it, on its own, I mean, I wouldn't bother to take it on its own. You want to get spice You want to get spicy? I got no problem with it. You want to take it? Take it. I'm just telling you that when it comes to results, I like the combination of things. Okay? I like the combination of things. I like, for example, for me, hot flashes and that. I always like black cohosh, but in combination. Okay? Have a look at our menopausal formula. You'll see what I mean. It's a combination of things. Okay, let's see. Let's get back to the questions. That was Shelley. Thank you, Shelley. And someone else is asking here. Okay. No name. So, hello, no name. I'm scheduled to have my uterus taken out. Okay. And they're going to give you estrogen for 14 days, then 3 times a week until the operation. It says it will reinforce my muscle skin of the vagina to get ready for the operation. Look, I'm not going to tell you, no name, not to do what your doctor said. I'd be cautious. I don't like giving. Remember, I did bioidentical hormones for years. Okay? Did I like estrogen? No. Because we live in a world of estrogen, and estrogen is a growth hormone. We talked about it when we talked about this week breast cancer. Women are so full of estrogen, they have no idea. And I've showed you pictures of estrogen all around the chest wall and dangerous. And look, but if you're going to take it, dim. Make sure you're on flax seeds. Make sure you're on our menopausal formula with dim, to dim out the extra estrogen, okay? Especially the xenoestrogens. Okay. That was no name. I don't know. Customer. Whoever that is. Okay. I love you. Thank you for asking. Let me just see. I thought I saw another one on, maybe not. No, I didn't. I think I answered it. So let's go back to the top. Kevin. I think Kevin's asked 2 questions here. Okay. He's 58 years old. Well, you're a pup, Kevin. Okay. You say here, wait a minute. Okay, because I got 2 Kevins unless they're 2 separate guys. Can you discuss CAC scoring, its usefulness in determining cardiac risk and the role of K2 in reducing A1C? Well, look. The calcium coronary artery test, okay? Let me give you a little bit of just my perspective and the negativity on it, okay? Because I was talking to someone the other day, an old friend of mine and patient, and they were given a poor coronary artery calcium score. And I mean, the guy is going to have a heart attack over thinking about that poor score. Okay. And God love him. The doctor scared the life out of him. And of course, the doctor wanted to put him on statin drugs. And I said, like, for me, okay, just understand that I'm giving you opinions, okay? You're not my patient, Kevin. So I'm giving you an opinion. I find they use that test too much to medicate the life out of people. That's what I found. I'm not dismissing the test. I'm not. But is it preventative? Yeah, if you change your lifestyle, not medication, but lifestyle changes, food, cut out the sugar. You want to be on vitamin K2. Okay? That's why we put it in our vitamin D, K2. And why? Because if there's any calcification, even of your coronary arteries, you want to lubricate. I'm a very, 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 very dogmatic when it comes to lubricating your blood vessels. Because even if you have some calcium on it, the idea is to lubricate, keep those blood vessels supple so they don't get hard in atherosclerosis. Can you reverse it? I've seen it. Now, in the meantime, I want you to lubricate. I want you to open up the blood vessels even more with nitric oxide. So I'm very big on Navitol in combination with DHA. One lubricates and the other opens those blood vessels even wider with nitric oxide. You hear nitric oxide is being advertised on TV. Eat beets, okay, to elevate your nitric oxide. Well, I'm going to tell you something. Pine bark is 100 times stronger than a beet. Do I like beets? Well, not particularly. I don't like the taste of them. But I'm not saying they're no good for you. Sure they are. Okay? You want to eat a beet? Eat a beet. I don't like beets. But I love nitric oxide. So, okay, now, what else did you ask me? Kevin, you said, at my advanced stage, at 58. Kevin, you're a puppy. Okay? It's all perspective. I mean, 58. I'm 73. Gonna go on 74. You're a puppy compared to me. Okay, now, you're saying you're in trouble because of your A1C is high. But you said 5.4. Now, unless you made a mistake on that. Because 5.4 is good. 5.4 or less on A1C. Okay? And I love that A1C. I love A1C. I want to know, Kevin, your triglycerides. I want to know your HDL cholesterol because you know me in metabolic syndrome. But at 5.4, you're not diabetic. I mean, in terms of, unless you got the diagnosis of diabetes, but 5.4 is it's good. If you were lower, even better, but 5.4 that's my cutoff line. I don't want you to be above it. Okay. What else did you ask me? Okay. You're asking me about the score. I don't get into scores. I mean, you could, Kevin. It's not part of the package I look at. Okay? If you want to show me that, I'll make it part of your package. But to talk to people, you don't hear me. This is the greatest test since sliced bread. I don't say that. I like A1C. I like triglycerides. I like HDL. I like CRP. Read my book, Sun, Steak, and Steel. I'll tell you what blood test to get. Because you got everything there. I even talk about homocysteine in there. I like that test too. Okay? So, Kevin, I hope I answered your question. How do you get, and by the way, I did talk about chelation therapy. Okay? So if you found out your carotid arteries are all blocked up, well, there's a chelation therapy. Okay? I did it in my office. You can do it IV, EDTA. Okay? It's vinegar-like. I explained this last week, I think, on question and answer. Okay? And I used to do it by EDTA, chelation. They actually developed it after World War II in order to get lead. Men coming back from war, a lot of Canadians, Americans had lead poisoning. So they developed a substance called EDTA. It's like vinegar. You know when you de-lime your coffee machine? Who's de-limed their coffee machine? Okay? It's vinegar-like. Well, I use vinegar. What does that do? Takes calcium out of your coffee machine. And the same science was used to develop EDTA, okay? And I used it in my office when I was in practice, either through IV treatment or they had them in suppositories that you could do through the portal vein and right into the liver, EDTA. You can look it up, okay? Merci beaucoup, Kevin. At my advanced age, I would still shocked when I read that. You're 58, Kevin. You're a puppy. Okay. Let me see. Did I miss anybody back in here? That was Kevin. I got Shelley. June. Let's talk to June. Hi, June. June is 77 years old. Now, June, you're still a puppy too, okay? You're a pup. Okay. I have a sluggish thyroid. Yeah, well, you and millions of other women, okay? I'm in my 50s and belly fat. You got belly fat, you got high cortisol. Okay? June, you have high cortisol. And that'll slow your thyroid to a crawl. Why? Because remember, I showed you on the chart. I showed you on my pyramid. When your cortisol is high and cortisol is circulating in your blood, what does it do? It robs progesterone. What does that do? It allows estrogen to be dominant. What does that do? Estrogen dominance slows your thyroid to a crawl. You have trouble converting. When you have estrogen dominance, you have trouble converting T4 to T3. T3 is the hormone. And remember, your thyroid is so finicky. It's so finicky. Why? Because it's got a lot of, it's a puppet. It's got strings coming from the brain. And that's why our cortisol formula and our thyroid formula, we work on the hypothalamus too, because it starts at headquarters. Hormones start at headquarters too. Your hypothalamus. You need to fix and balance that pituitary. And then the adrenals leveling out your cortisol, because that's so important for your progesterone to balance out your estrogen and make your thyroid work better. So that's what I would say to you, June. Okay? And your A1C, holy moly, 6.5. That is very high. Okay? So are you eating the, well, June, if you're not eating the reset like, okay, do the reset. I recommend it. And then eat reset like, okay? That means focus the majority of your foods on animal products, eggs, meat, and cheese. Live there. And you can have a few vegetables if you want, okay? You can have a little bit of fruit if you want, but don't live on that. Your A1C, way too high. 6.5 is very high A1C. Okay. You're really a diabetic probably, and you don't know it. Don't wait till a doctor tells you you're a diabetic. You and carbs, June, don't get along. Guaranteed. Okay? Okay, Brianna. Thank you for asking the question, Brianna. And you said, okay, or you heard from a naturopathic doctor not to eat pork. Okay? Why? Because it has parasites. Okay. I'm going to get a headache Okay? I'm going to get a headache, Brianna. And the reason I'm going to get a headache is the talk about parasites. Okay, now, do you have a pet at home? You have a dog? You have a cat? Okay, especially cats? Then you have parasites. 100%. You let your dog lick you? You have parasites. 100%. Okay? Now, pork is good for you. It's considered a red meat. Not as high as steak, but it's good. It's protein. Very good for you. Okay? I know I go against the grain. Okay? And I know there are people like Seventh-day Adventists and God love them and all this and that, religious purposes, the Muslims, and God love them. Okay? I mean it. But they're wrong. They're wrong. Now cook your pork properly. That's really important. Okay? But pork is better than a granola bar, a sausage, and bacon is 100 times better than oatmeal. So, parasites, cook your meat properly. Now, not a steak, because you don't get parasites from steak. Sun, steak, and steel. Now listen, like I said, and I mean this, because people, parasites, Dr. Martin, cancer, hey, I'm not saying it's not a factor. All I'm saying is, if you want to get rid of parasites, then don't have a pet in your home. Don't let a pet get on your bed. Don't let a pet lick you. Don't have a cat. Because you have parasites. Your body is made to fight that. How many of you sleep with the enemy? Your pet. I had so many patients over the years, and when I told them that, because I'd show them parasites in their blood. And I said, well, quit kissing your cat. I love my cat. I said, your cat don't love you. Cats don't love anybody. But they'd look at me like I had two heads. Well, I said, well, turn away from the screen if you don't want to see a parasite. You got parasites. Okay? I'm going to show you how to get rid of them. But they're not going to, if you kiss your pet, you're going to get them back. I'm sorry. So take care of yourself. That's why I love probiotics and that. Guys, I'm just telling you, like, people, the naturopath said I got to never eat pork again. It's got parasites. Yeah, well, so does your cat and dog, okay? Your dog's got parasites. 100%. %. Anywho, and I'm not even telling you to get rid of your pet. You notice that? I told a lady once, you heard about the cat story. Now that's about, I use it as an analogy. Because the lady was allergic and she came in and I knew she had allergies because I saw her blood work. She was full of mast cells and her immune system was firing on, and her mast cells were releasing histamine. And I said, you got allergies? She said, oh yeah, that's why I'm here, doc. I said, well, what are you allergic to? My cat. I said, well, get rid of it. Then she said, I can't. I said, well, then, what do you want me to tell you? I can't help you. You're allergic to your cat. She said, I can't get rid of it. Well, Okay? And when you're a diabetic, you're allergic to carbs. And then I had diabetic patients tell me this. Well, Doc, I can't stop eating carbs. I said, well, you're allergic to them. What? You're allergic to carbs? You and carbs don't get along. Stop eating them. Stop it. They thought I was joking. I can't eat my eggs, Dr. Martin, without bread. Are you kidding me? What am I going to dip my eggs in? I said pretend. Okay, that was, I got all excited. My word, let me see. I might not get to the bottom of this. Hold on. Okay, you know what? I'll tell you what I'm going to do. I'm going to, because Brian's asking about the difference between a mammogram and thermography. We sort of touched on that this week. I can sort of talk about it again. Diverticulitis. Okay, I just want to see if I'm missing anything here. Okay, you know what? I got a few more questions. We'll leave them till Monday. I'm not going to probably just do Monday. I probably have a few studies that I do have a few studies I want to talk about. Okay, so we'll figure that out. Okay. Did you have fun today, guys? Okay, I did. Okay. I love your animals, okay? Don't get rid of them. Don't say Dr. Martin told me to get rid of my animals. I didn't. Unless you're allergic to them. Okay. We love you dearly, guys. And we'll talk to you soon.